Hi everyone, welcome to Mom Talks. I'm Kendra. I am ready for a 3-day weekend. I don't know about you all, so I hope everyone's got some great plans this weekend to kick off the end of summer, even though for many of us, we're already back in school and back in those fall schedules. So today we're going to be continuing our discussion about those different checks and exams your kids are going through as they go back to school. And today it's a big one. It's your eyes, which goes into just about everything with learning, from seeing when it was when I was a child, it was seeing the chalkboard or reading books, or just generally being able to be engaged in your conversations with your child. So I have Dr. Mark Rallo here. We're here at the Children's Specialty Care Center. Can you tell me a little bit about the practice that we have here?
So yeah, we've actually been in this facility now for I believe about 4 or 5 years, and parents love the facility. Parking's easy access. We don't have to deal with the garage. And it's a little bit calmer here than it is at the main location off Kings Highway at Children's Hospital. But we have 4 pediatric ophthalmologists, we have 5 optometrists, and then we have 3 orthoptists. We just hired an orthoptist from Australia. If you can believe that.
Wow, long way from home.
It is a big practice. Absolutely.
And so let's talk about your child getting an eye exam and starting to look at, any problems that might be developing, or just making sure they're able to see correctly in their day-to-day life. So when do you recommend a child have their first eye exam?
That's a great question, and I get this question a lot from parents.
Mm-hmm.
And I would tell you there's probably not an exact answer for that. APOS, which is the American Association for Pediatric Ophthalmology and Strabismus, and the AOA, the American Association, American Optometric Association, have some differing views on this. So the AOA developed what's called the Infancy Program. I believe it was 2005, and it was funded by Johnson & Johnson, and the idea was that local optometrists would actually do comprehensive eye exams on babies between ages 6 and 12 months. Mm-hmm. And it was at no charge, which was really nice. And then they recommended another exam between age 3 and 5, and then mm-hmm. yearly after age 5. The APOS group really doesn't follow those guidelines. In fact, they really depend more on these vision screenings that pediatricians mm-hmm. are providing, and the technology that is available to the pediatricians. They can actually check children as young as age 1. Matter of fact, I've seen babies younger than age 1 who've had these screenings. Whereas before, child had to be able to identify pictures or letters in order to be checked. So they're leaning more on the pediatricians doing these screenings, and also parents and what they're observing. If a parent suspects their child has a vision issue, or are noticing that the eye is crossing, or maybe they see an abnormal red reflex in a photograph, they certainly need to call their pediatrician, make them aware of this, and then we can move on as far as scheduling an eye exam. So my personal thought is, I think certainly by age 5, before the start of kindergarten, every child should have a comprehensive eye exam, or at least a good screening by their pediatrician. And I think there's good arguments that every child by age 2 should probably have that done.
So whenever you're talking about age 2 having something like that done, or age 5, most parents might think that's awfully young. Why is that timing important?
So, like most medical conditions, and the eyes are no exception, the earlier we detect something and the earlier we can start and initiate treatment, the better prognosis. Mm-hmm. And so, like most things, we want to catch these things early, because in a child, particularly with vision development is taking place at a very young age, and so it's very important, again, that we address issues that may be present so that there are no long-term implications down the road.
So if parents are maybe suspecting, even in their very young child, their toddler, that there's a vision problem, what might they be looking for?
So again, a couple things that they may pick up on. A child may be squinting mm-hmm. to see something. I have parents that will bring their child in and say they're holding their books close or getting right on top of the TV to see it. Those could certainly be indications that a child's having trouble seeing.
So it looks like we have a question. We'll go ahead and take this question.
Sure.
So once they reach school age, are there any questions that parents can be asking teachers to help identify some of those eye issues?
Yeah, I've heard of teachers approaching parents and saying,
Yes.
I don't think your child is seeing well.
Correct. Yeah, so most teachers are very adept at doing this. They'll notice if a child is struggling to see the board, as you said, it's a chalkboard anymore, but the smart boards and so forth. So Teachers, again, are able to a lot of times determine that a child is having a vision issue. But as a parent, I think it's just important that, if they have any concerns that their child may or may not be seeing well, that they let the teacher know and kind of give them a heads up so that they can watch for issues in the classroom, whether, again, it's trying to read a book or from a book or see the board at school.
So whenever parents bring their child in to see you for the first time, that it seems like they have a pretty good idea there could be a problem, or likely.
Most times, although unfortunately sometimes we deliver news that parents are not expecting whatsoever.
Sure. Mm-hmm.
Yes.
So whenever a child comes in for their first eye exam, what are you looking for?
So I kind of break down an eye exam for children into 3 groups. One is vision. So obviously we're going to determine if glasses are needed. The second thing we check is binocular vision, specifically things like strabismus, which is a technical term for like eye crossing or maybe a drifting of an eye. We want to make sure the eyes are tracking together well and that they have good depth perception. And then finally, the ocular health assessment. We want to make sure that the eyes are healthy.
Over the course of a child's life, how often should they see an eye doctor?
Again, I think, it depends on several factors. So it depends on what their actual history is, family history, their medical history. Children who are diabetic should probably be seen on a fairly regular basis. And so not every child needs to be seen yearly, certainly. Although we have some kids that, that is in fact the case.
So let's talk a little bit about some of the things, diagnoses that they might see. So let's start with, what if they aren't seeing well? Would you jump straight to the glasses, or what do you recommend? So
a lot of it's going to depend on their age. And so if a child comes in and they're fairly young and I prescribe glasses, or find that they have a vision issue and prescribe glasses, that would be the starting point, certainly. Typically around the age of 10, maybe 12, contact lenses starts to become a better option. And as we all now know, there are technologies available, refractive surgery, that we also perform on children, particularly if they have developmental delays and maybe won't or can't tolerate glasses and or contact lenses.
So talk about some of the other diagnoses that you might have. Just you mentioned eyes tracking together or different things like that. What kind of treatment options are available to families?
So if a child has strabismus, as I said, a good example is eye crossing. There are actually 2 potential mechanisms that could cause a child's eyes to cross. One could be that they're quite farsighted, and that's an easy fix. We just put them in glasses, and that typically is all they need. Unfortunately, other children, the eye crossing is due to a muscle issue, and they typically require surgery. And then in some cases, actually, both are needed. It's called mixed mechanism esotropia. And so, but again, we're looking at a variety of things. The eyes are a very complex part of the body, and so, like I said, there are many, many things we're ruling out in an eye exam.
Is the surgery done here, or is it done at the hospital?
We actually are capable of doing surgery at both locations, although some of the more complex surgeries we do reserve for the downtown location.
Sure. So let's talk about a child's first pair of glasses. What do you tell parents and kids about, okay, you've got glasses now, what do you tell them as far as use, wear, all those things?
Sure. And again, for some kids, it's a full-time wearing schedule, and other kids I may recommend it's only during school or when they're maybe reading something along those lines. And that's in some cases very traumatic for parents. You wouldn't think it would be, but when their 1-year-old baby or their 2-year-old infant is told that they need glasses, unfortunately this can certainly bring some tears to parents' eyes. So the nice thing is we're not going to prescribe glasses unless it's absolutely necessary. Typically these are kids that have significant what we call refractive error, like nearsightedness or farsightedness. And so the biggest issue I think for parents, once they kind of overcome the emotional hurdle, is that they really are concerned their child will not tolerate or wear the glasses. And as I usually tell them, the majority of kids do quite well because, like I said, their vision is not good, and that's why obviously we're prescribing glasses. And when they put those glasses on for the first time, I mean, they will see a difference in the child.
So much better.
And we do have battles with some children that just absolutely don't want to wear the glasses. Now, sometimes it's just an age factor, and there are some things that we can do to maybe help that. A big factor nowadays, unfortunately, is the social impact of glasses. Other kids, making fun of children who wear glasses. So it's not always an easy treatment for the child or the parent to deal with. But like I said, in most cases, if we're prescribing it, it's absolutely necessary.
Is there an adjustment phase that goes through for a child wearing glasses? Like I remember when I got my first pair of glasses, I felt it a little around the bridge of my nose by the, just getting used to wearing glasses every day.
It depends. Like I said, some kids, I've had parents tell me they put the glasses on and they never took them off after that. Again, sometimes parents do encounter some issues with compliance with the glasses. And as I said, we have some strategies that we can initiate if that is a concern. But you touched on a good point. And that is sometimes if children have sensory issues and they have something sitting on their face, they're just not going to tolerate it. And those are children that sometimes would benefit from refractive surgery because we can do generally two options that we can look at. That way, if they're very intolerant of the glasses, at least we have an alternative treatment that we can offer the parents.
So I know when talking from my personal experience, I wasn't allowed to get contacts until I was in 8th grade because my parents said, okay, you get contacts, you have to care for them, you have to clean them and everything, and, take them out and put them in and everything like that and be responsible. Sure. What do you tell parents as far as when your child might be ready to have contacts?
I typically say average age is between 10 and 12. I tell parents, and we really don't as a practice fit contact lenses other than medically necessary. We did several years ago. I actually fit a young lady who was 7 in hard or gas permeable lenses. So I tell parents 10 to 12 is average age, but I've had much younger kids that we fit with contacts. A lot of times it depends on motivation, what's driving the child to wear contacts, and their maturity level. And as you know, kids are very different when it comes to that. And so just as easily I could fit a child who's 7 with contacts, I may not be able to fit a 14-year-old with contacts. And so like I said, I think the two biggest factors are motivation and maturity level.
Eye exams are sometimes hard to sit through, even for adults. How do you make kids feel comfortable when they come in?
So one of the things that I hear from parents who maybe have had their child examined elsewhere is that it didn't go very well. And that's not true of older children, but with the smaller, the infants, the really young children, one of the nice things here is that we have a lot of different things that we can have the child look at. We have videos that can capture the child's attention. We have toys, stickers that we put on our noses, and so forth. So, but yeah, so we have a lot of things to capture their attention. That being said, eye exams on children are not always easy, and so we sometimes have struggles. I always kind of chuckle because parents will get upset, with their child and feel like, oh my gosh, this is the worst patient they probably ever had. And of course, I'm sitting, I'm sitting there thinking to myself, not a big deal. We do this all day long. So, but yeah, the exams generally go very smoothly, and so I think parents, for the most part, walk out of here very satisfied and feel a little bit at ease because, like I said, we can do most of the testing that we need to do because, again, we have these toys and other things that really catch the child's attention.
So some parents might be watching this and going, well, my child hasn't complained about any eye issues. I'm not concerned. Maybe this is one we can give a pass. What's the problem with skipping the eye exam?
So I would say one of the big issues that we run into is a child who has a condition called anisometropia, whereby they may be very nearsighted or farsighted or have significant astigmatism in one eye and have little or none in the other eye. That child's going to walk around like everything is normal. They're going to function normally visually, and parents, teachers are not going to be aware that there's a problem when in fact they're really dependent on one eye only. And so that's where these screenings, whether it's through school or the pediatrician or a good just baseline eye exam, will come into play because, like I said, I've had parents bring children in thinking everything was great, and unfortunately I had to break bad news and tell them everything's not as good as you may have expected. Again, some parents have clues and they realize there may be an issue, but there are times with these children that parents are stunned that they may need glasses or other treatment.
Dr. Rella, thank you.
That's
going to wrap us up for Mom Talks this week. We will be right back here next week, 11 o'clock on Friday, and we've got another fun topic. We're going to be talking about dental exams for your child. We're going to be speaking with Emily Hahn. She's one of our pediatric dentists, and we're going to cover everything from your child's first dental exam, what they're watching out for, and when are they going to start losing those darn baby teeth. We'll see you soon.